So the ITC program is a Care Coordination Supplementary Services program that we fund throughout the region. And basically what that does is coordinate the care of Aboriginal people that have a chronic disease. We fund 4 service providers throughout the region. One based in Tamworth, one based on the Central Coast, Taree, and here in Newcastle. The eligibility for the program is to obviously have a chronic disease along with a GP referral into the program. What the program's aim to do is get people with a chronic disease to self-manage their condition. And that can be through a range of education programs, but also brokerage services to allied health or specialists.
We're talking about lifestyle behaviour management, and yes, it's embedded in chronic disease, but we want people to get skills, just very basic skills, to actually be able to speak up for themselves. And if we can help people speak up for themselves, I think that we're giving them the skills to actually be part of their own journey.
One of the main key linkages that we have in the program is the Aboriginal outreach worker. And I think without having that worker there, the success of that client wouldn't be as good as what it is.
I'd say 99% of our care coordinators are Aboriginal as well. So I see them as equals, and they do work in like that, managing the client's health journey.
What that allows the care coordinator to do is to assess what specific services that person may need. And that can range from a whole heap of services depending on their health needs.
Clients feel that they're talking to someone that they know has perhaps gone through it or understands what's going on besides their health. We like to look at it as very much a holistic approach.
They know the community and they know the people. So they're there to really be that frontline worker to help people get into the appointments and specialists that they need.
I got diabetes when I was 16, I think it was. Had it ever since. I'm 31 now. Well, the doctor told me that I wouldn't see the age of 30 if I kept going on the way I was, but 31 still going, you know. So my grandfather's side of the family all died at a young age, 53 and 52. And you know, that was a big thing with me as well growing up, because I didn't have my grandfather around. And you know, you just got to keep your elders around. Like these days, you got some of them going getting old and dying of old age, but very rare. You don't have your elders, well, you don't have nobody really. That's where we learn. That's where we get everything from. Our knowledge. That's where we learn everything. Respect. You know.
The holistic care is so important. We cannot look at an individual without looking at their whole environment.
I got a relationship with the community. Every single one is different. Like every single one in my community is different relationship I have with them.
Everybody's experience is different. So I think is actually thinking dynamically about what you have for your funding and looking and being responsive to what's happening in chronic disease land.
We do make a difference in the community. I hope that the government can see that this long term is going to be beneficial, as well as continue funding the healthy lifestyle programs that can maybe help prevent some of these chronic disease.
The same model of care is about capacity building and choice and self-determination, and I guess the skills in helping your team help the person self-direct themselves is really vital. And obviously layered with your mentors that are Aboriginal people in your networks and in your team, is that making sure it's the balance of all those things to actually look after the person as a centred person, not just a patient that's a number in the program.
Mainly what we want to do out of that program is educate the community. So educating them on their health and ensuring they actually know what a chronic disease is and how best to manage that.